So let's have a discussion of the X-rays of the tumors. Whatever we have studied, we are going to utilize those events in order to identify the given X-ray that given X-ray is for the tumor of. All right. So let's have a discussion, and it will become much easier if we have understood all the backgrounds in the form of the theory. So first of all, in this particularly given X-ray, first of all, you have to identify that, or you have to locate that where the lesion is. So once you have located the lesion and find this out to be an epiphyseal tumor. Now imagine this is the epiphyseal tumor. The moment you have confirmed it to be an epiphyseal tumor, you are left with two options only. One is chondroblastoma and the other one is GCT. So these are the two tumors you are left with. Now you have to identify whether it is chondroblastoma or a giant cell tumor. You know, in the table of age predilection, you have written that from 10 to 20 years of age, chondroblastoma is the tumor of less than 20 years of age. All right. While GCT is the tumor of a skeletally mature individual, that means 20 to 40 years of age. So whether this is the X-ray of a skeletally immature or a mature individual is going to be decided by the visualization of the growth plate. So if the growth plate is still visible, it means this is a tumor, or this is the X-ray of less than 20 years of age. That means a skeletally immature individual. While if the growth plate is not visible, that means this is the X-ray of a skeletally mature individual where the growth plate is fused. So in this particular X-ray, growth plate is still visible. That means it is assumed we are looking at the X-ray of less than 20 years of individual. And the moment you have confirmed that growth plates are still visible in the X-ray, then possibility that the tumor you are visualizing over here is a chondroblastomatous tumor. That means if the epiphyseal tumor is provided with the growth plate intact, it is chondroblastoma. All right. On the other hand, if you locate another tumor which is again found to be epiphyseal, then you are left with the same two differential diagnoses. One is chondroblastoma and the other one is GCT. Now, you have to differentiate whether it is chondroblastoma or GCT based upon the appearance of the growth plate. Now, in this case, the growth plate is already obliterated. That means the growth plate is already fused. So, thereby it is assumed that you are looking at the X-ray of more than 20 years of individual. All right, 20 years of age. That means he is a skeletally mature individual. So, you can safely go with the differential diagnosis of a giant cell tumor. So, this is how you have to identify the tumor, not on the basis of its soap bubble appearance, not on the basis of the calcification. All right. So those soap bubble appearance, onion peel appearance, the fallen leaf appearance, all these appearances are theoretical, not for the purpose of identification. The identification is involved, or identification is processed through the learnings and ruling the other options out. So this is how you have to approach for the given or provided the X-rays. Now, for this particular X-ray, one thing which is very much clear, that you are looking at a malignant tumor. This tumor cannot be a benign tumor, it is a malignant tumor. Now, this is a kind of a malignant tumor which has got a central core and then it is peripherally spreading. Now, the spreading part of the tumor is relatively radiolucent while the central core is radiodense. And this is exactly what we have studied in case of osteosarcomatous tumor. Now, in osteosarcomatous tumor, what we have identified, that the central core is more dense compared to the periphery because the central core becomes necrotic as the neovascularization is assisting the peripheral spread of the tumor. So this is what the tumor, the X-ray appearance is that of a sunburst appearance or a sun ray appearance, and the tumor you are visualizing over here is osteosarcoma. All right. Proximal humerus is, in the upper limb, proximal humerus is the most common site to be affected by osteosarcomatous tumor. Now, one of the X-ray finding that you have written, a speculed, that means inhomogeneous kind of a C-shaped, comma-shaped or a popcorn kind of a calcification which is disorganized or ill-organized. So it is representing a cartilaginous bound tumor, and in a case where the tumor is spreading beyond its origin confines, that means it is a malignant cartilaginous tumor. The name of a malignant cartilaginous tumor is chondrosarcoma. And this is what you have written, that chondrosarcomatous appearance is a inhomogeneous kind of a calcification, C-shaped calcification, comma-shaped calcification. These are the different synonyms which are provided. But the essence is that whenever you see this irregularly patterned calcification beyond the confines of a normal bone, you assume it to be originating from a cartilaginous tumor. All right. So this is how the chondrosarcomatous X-rays looks like. Now, if this is the kind of the X-ray which is provided to you, then it is going to be a spot diagnostic question, because when you assume it to be, when you look at the when you look at this tumor, it is a outpouching from the normal bone from the metaphyseal end. All right. So it is a growth from the metaphyseal end of the distal end of the femur. Now it could be pedunculated or it could be sessile. Means if a tumor, imagine if a leaf is attached to its branch through a stalk, then it is pedunculated. While if a leaf is directly attached to a stalk without any stalk, if the leaf is directly attached to its branch, then it is sessile. All right. So these are the two kinds of the attachment of this tumor to the parent bone. Now here there is a outpouching or a tumor which is outgrowing from the normal metaphyseal region of the bone, and the moment you see it, you have to mark the diagnosis as osteochondroma. This is nothing but the osteochondromatous tumor. All right, or exhaustosis. So majority of the time when you are provided with the X-ray, they can give you some of the hints in the form of a theoretical assistance, but this is the kind of the X-ray which you will get in the form of a spot diagnostic question with or without any theoretical assistance. Just by looking at the X-ray, you can assume it to be an osteochondromatous tumor, and as I told you that the metaphyseal continuity of this osteochondromatous tumor with the parent bone. Imagine if there is no breach in the normal cortex or cortex of the parent bone, then it is not osteochondroma. Hopefully you have understood how to identify this tumor in particular. Now, there are two cystic lesions that we have talked about. One is a kind of a cyst which remain confined within the normal cortices of the bone to a longer extent because it is gradually expansile. While on the other hand, there is a kind of a cystic lesion which goes beyond the confines of a normal bone by thinning out the margins of the cortices. Point number two, one of the cysts is clear without any septations or fragmentations. On the other hand, other kind of a tumor is having multiple septations, multiple fragmentations and loculations. All right. So if you look at this metaphyseal tumor, here we are having a cyst which is well located within the confines of the normal bone. Now this is the kind of the cyst which remains or which could remain asymptomatic for a long duration of time. Moreover, rather it could be an incidental finding following a slight amount of the trauma. So this is the cyst which you are going to compare it with the theory where we have talked about it. So it is a simple bone cyst. All right, a clear cyst within the confines of the bones in the metaphyseal region, not leading to the thinning out of the margins without any septations. On the other hand, if you look at this metaphyseal region of the bone, here you are seeing a cyst which is multiloculated, which are having multiple septations, and it is a spreading kind of a cyst which is responsible for causing thinning of the cortices. So this cyst is aneurysmal bone cyst. All right. Now, honeycomb appearance is the name which is given to aneurysmal bone cyst. Fallen leaf appearance is the name which is provided to, which is the X-ray finding for simple bone cyst. But don't utilize these theoretical appearances to identify the tumor on the given X-ray. For the purpose of identification, you have to rule the other options out based on the knowledge which were provided to you in the forms of the tables. All right. So it will become much easier for you to identify that what is the name of the tumor that you are visualizing at. So this is how the simple and the aneurysmal bone cysts are identified. Next, whenever you are provided with the X-ray of any region of the hand and they are asking anything related to the tumor, then you can safely go with the differential, or you can go with the answer of enchondroma. You know what we have seen, that enchondroma is the most common tumor of a small bone in hand. It is a benign tumor, metaphyseal tumor, a lytic lesion which will result in the degeneration or disintegration of that particular region of the bone. So enchondroma, whenever you are provided with the X-ray of the hand and they are asking anything related to the tumor by marking it, answer for that question most likely is enchondromatous tumor or enchondroma. Next, onion peel appearance is something which we have already talked about by giving you the examples of how this periosteal reaction gets arranged in the form of its layers, and this layer when gets more and more calcified will appear like a peel on the X-ray. So this onion peel appearance, that means presence of the periosteum beyond the confines of the normal bone in the diaphyseal region, is the X-ray which is suggestive of Ewing sarcoma. All right. So this is again much easier for you to identify. So this location of the tumor is also very important. Like in case of enchondroma, it is a metaphyseal tumor, so it will be appearing in the metaphysis. In case of simple and aneurysmal bone cyst, both of them are metaphyseal. And here also you can see, or you can confirm it to be a metaphyseal tumor. In case of osteochondromatous tumor, this is also again metaphyseal tumor. So in the distal end of the femur metaphysis, this tumor is getting outpouched from. So this is how you will identify and relate with the locations of that particular tumor. Next, punched out lytic lesion. Punched out or a large lytic lesion in the skull or multiple lytic lesions in the lumbar vertebrae are going in the favor of multiple myeloma. So this is nothing, or identifying this kind of a tumor is not a task, because simple punched out lytic lesions of the bone, punched out lytic lesion of the skull goes in the favor of multiple myelomatous tumor. Next, we have talked about X-ray finding, which is considered to be diagnostic for that particular tumor. When we were writing about the X-rays in the given in the provided table, then you have written that if there is a presence of a small radiolucent nidus within the long bone confines of the cortices, it goes in the favor of osteoid osteoma. So this is that a small radiolucent nidus within the long bone cortex in the diaphyseal region. So this is how the osteoid osteoma lesions looks like. And when you see this kind of a circular radiolucent small lesion within the cortex of the long bone, it is certain, it is diagnostic for osteoid osteomatous lesion. All right. Now, Shepard-Crook deformity as well as ground glass appearance, both of them goes in the favor of fibrous dysplasia. Now, this is something which means this Shepard-Crook deformity in particular, they can ask. It appears like a stick of a shepherd. All right. So this Shepard-Crook deformity, that too seen more commonly in case of proximal end of the femur. So this Shepard-Crook deformity as well as ground glass appearance, both of them goes in the favor of fibrous dysplasia. Next, now in this case, before we talk about that it is the X-ray appearance of which tumor, you have to identify that what are the structures which are visible and what are the structures which are left out. Now in this particular, you have to understand that what is the significance of this kind of the X-ray. Now in this case, you are visualizing the five of the vertebrae. Now imagine this is first, this is second, this is third, fourth and fifth. All right. So these are first, second, third, fourth and fifth vertebrae. Now what is happening? If you look at this, these are the pedicles of the vertebrae. So this is a pedicle. On the other hand, if you look at this structure, this one is the spinous process of the vertebrae. All right. Now, if you combine both of them, then it appears like a face of an owl. This entire anteroposterior view of the vertebrae appears like a face of the owl. Now, in this vertebrae number 1, both the eyes of the owl, that means both the pedicles are clearly delineated. They are visible. Similarly, in case of vertebrae number 2, both the eyes are clearly visible. In case of vertebrae number 4, both the eyes are visible. In 5, both the pedicles or the eyes are visible. All right. But in case of vertebrae number 3, what is happening? That one of the eye is visible, but the other eye is not visible. That means other of the pedicle margins of the pedicles cannot be delineated. That means if you look at this face of this owl, of the third one, then one of the eye is blinking, one of the eye is not visible. That means one of the eyes seems to be winged, and this is what is known as winking owl appearance. And you know what the winking owl appearance is? That one of the eye is closed. Winking owl appearance is a feature which is suggestive of secondaries in the vertebrae. All right. And you know, the most common site for these secondaries to be identified in is the vertebral column. So winking owl appearance as well as blind bat sign, both these two X-ray findings you have written in case of your long X-ray appearance table, and both of them goes in the favor of a secondary. All right, winking owl appearance as well as blind bat sign. Now, what is blind bat sign? Imagine when both the eyes of the owl, that means both the pedicles of the vertebrae are not visible, then it would be called as blind bat sign.